Good morning. Welcome back to 1160 a.m. KBDT News Talk Sports. We're JP, Kathy, and the crew. We come to you live Monday through Friday from 7 a.m. to 9 a.m. And today is Tuesday. That means we have the Mental Health Moment brought to you by the Morgan Foundation, Something for Kelly Foundation. And here at JP, Kathy, and the crew, as we continue to strive to bring you those hard-hitting issues that face mental health. So every Tuesday, tune in right here at 8:34 a.m. and pick up as much information as you possibly can. This morning, we are very excited to have Christine Peat, Dr. Christine Peat in. She is the director of the National Center of Excellence for Eating Disorders. And so good morning, Patty. Good morning, Steve. And good morning, Dr. Peat.
Good morning.
Good morning, JP. And I think we are still waiting Dr. Peat to call in. She's had the number for a while, but she is with the National Center of Excellence for Eating Disorders in North Carolina. She is their director there, and she's going to talk to us today about weight stigma. And there have been recent studies that have come out indicating that body mass index, BMI,
right,
has recently come into question as not being an accurate predictor of a person's health.
Really? Because you hear BMI, I mean, forever and a day, and that's on your, annual wellness check. Everybody talks about BMI.
Absolutely. And actually all that is, you take a person's height divided by their weight, and it gives you a number.
Right.
Now, there is certain there's certain advantages to it, but on the other hand, it was developed in the 1800s.
Did not know that.
It was developed in Europe, is only tested on a small population, and it was never designed to pertain to individuals. It was more done to get a health in a group. Well, we now know that a person can have different types of weight, and that's not always an accurate indication of how healthy they are.
Right.
Until you get to a certain weight. Let's say if you have a BMI of 35, let's say, then the incidence of diabetes, heart disease, start to go dramatically up.
Right.
But there's also a recent study that came out in the UK just last month that showed that those in the slightly obese category have a longer life expectancy than those who are looked upon as healthy to thin.
Interesting.
So yes, so it's not always an accurate representation, and I believe Dr. Peat is going to address that. And yes, it has to be one tool that doctors rely upon, but that can't be the end.
It can't be. Yeah, it can't be the end all be all, I think is what you're saying.
Absolutely. Absolutely. And when you combine that with, there's no dispute that weight stigma exists in the United States today, and weight discrimination exists. And I believe now we have 2 states that specifically ban weight discrimination as in essence, a protected class. And in addition, some studies have come out which indicate that weight stigma can exacerbate a person's thought process, their health, and can lead to disordered eating as well as bulimia and binge eating.
And is that
disorder.
where, Steve, is that where things like body dysmorphia come into play?
Yes, exactly.
Okay.
The problem the eating disorder industry is having is that where do you draw the line between obesity, which is not a recognized mental health disorder, disorder
Right.
versus bulimia,
Okay.
let's
Okay.
say. And unfortunately, the lines seem to be beginning to get a little bit hazy.
Yeah, a little bit hazy.
Absolutely.
Yep.
And then again, on the drive in here today, I heard a report again from the U.S.,
Uh-huh.
which indicates approval for weight reduction surgery for children and adolescents. And I believe we have Dr. Peat.
Yes.
Good morning, doctor.
Good morning.
Doctor, apologize for the mix up here, but welcome to the show. And can you tell our listeners a bit about you?
Sure, happy to do so. My name is Dr. Christine Peat, and I am a clinical psychologist who specializes in the treatment of eating disorders, and I also serve as the psychologist for the UNC Bariatric Surgery Program.
Okay, so doctor, give us an idea what exactly that means. What do you specialize in terms of your day-to-day work?
Sure. So in terms of my day-to-day work, a lot of what I focus on is providing psychological intervention or talk therapy to individuals that have conditions like anorexia nervosa, bulimia nervosa, binge eating disorder, and I also conduct evaluations for patients who are interested in undergoing weight loss surgery.
Interesting. Okay, well let's jump right into that. Let's talk about weight stigma, what it is, how that has how it impacts a person's relationship to food and their health overall.
It's a great question. I think that one of the things that tends to be kind of universal these days is that no matter where you fall on the weight spectrum, somebody has to have some kind of relationship with food. And that relationship with food is increasingly challenging these days with all of the messages that we have about health, what foods you should be eating, superfoods, all of this information that's out there. So I think that one of the challenges is really trying to figure out what is the accurate information and what do we do with that information once we get it. And the weight stigma piece creates even more confusion, given that we know that individuals who live in larger body sizes tend to face certain kinds of discrimination that other individuals might not. So, for example, discrimination in the workplace, in school, even in healthcare settings. And we know that this is a very real concern that can have impact on not only mental health, but also physical health.
Doctor, this is Patty. Thank you for coming on, and we all really appreciate the way that you are going to be able to uniquely address this combination of weight stigma and eating disorders. So talk just a minute about some of the prejudices that people feel that they have while they're in the doctor's office as it relates to they come in with the flu and yet everything is focused on the size of their body.
Right. And one of the things that we've learned over the years through some really well-conducted research is that individuals who live in larger bodies may find that when they're going to the doctor's office, they may be going for something like an eye infection, or perhaps they're going in because they have the flu. But what they walk out with is sort of this prescription for weight loss, when it may not have any bearing on the type of presentation that they're there for in the first place. And this is one of the forms of weight discrimination or weight bias that you see in healthcare. But we also know that these same individuals are also reporting having more negative interactions with their physicians. Physicians have actually been surveyed, and they have reported having more frustration, a more negative view of patients that live in larger bodies. And this can have real impact on the type of interaction that's happening between healthcare provider and patient.
So this frustration is very real and very challenging. How does that then relate to the actual issues surrounding obesity? Talk for a minute about, okay, weight stigma is real, we acknowledge it, but now let's talk about the legitimate concerns surrounding obesity and medical conditions and health.
So I think that one of the things that becomes really challenging then is individuals not receiving the type of appropriate care that they might need because they're first being seen as a BMI or as a weight versus a patient with, myriad health concerns. So that, I think, is a very real thing that individuals face in the healthcare setting. I think one of the other really unfortunate things that happens is that because we have stereotypes in our mind about what eating disorders look like, namely that they occur in individuals who are thin or even underweight, individuals that live in larger bodies are often not even screened for eating disorders, and this can be a really serious challenge in terms of getting them the appropriate care.
So can you help us to understand how obesity and eating disorders intersect? Because not everybody who is obese has an eating disorder. And as you say, not everybody who has an eating disorder is obese. So help us to kind of get our brain around that, because I think that's a lot of confusion. You're right. People typically think of people that are underweight as having a disorder.
Absolutely. Yes, that's a great clarification. I think that what we know is that eating disorders do not discriminate. It does not matter if your body weight or shape or size is sort of within what the medical guidelines would say is normal limits. It does not matter if you live in a larger body. An eating disorder can happen at any time to any individual. But because we have stereotypes about what eating disorders typically look like, namely that they're happening in women, that they're happening among Caucasian individuals and among individuals who are thin or underweight, if you do not look like that stereotype, oftentimes you're getting missed in terms of screening opportunities. But we do know that anyone can struggle with symptoms of an eating disorder, whether that's binge eating, whether it's dietary restriction, or using some kind of inappropriate compensatory behavior like fasting or exercise.
When you are counseling people pre-surgery for consideration of psychological issues for bariatric surgery, do you do any screening at that time? Talk about the medical work that you do as compared to the psychological work, and how do you make sure that they have the best chance of success if they are going to have surgery?
Absolutely. I think that one of the most crucial things that a psychologist who's doing these kinds of evaluations can really do is to be screening for and asking for a thorough history of any kind of eating disorder symptoms. So those would include things like, really extreme dietary restriction, any kind of abuse of diet pills or other kinds of medications. And we're really doing this kind of as a safety measure to make sure that individuals who are going to pursue these permanent surgeries are carefully screened for things that could put them at risk afterwards. So as an eating disorders expert who is also doing these types of evaluations, I'm in a unique position to be able to be screening for these types of symptoms to make sure that folks really get the type of care that they need. And that may mean getting some talk therapy or some kind of mental health therapy prior to having surgery to make sure that this is adequately addressed.
Dr. Peat, this is Stephen Dunn. Before you jumped on the air, we began to talk about BMI, and we know that BMI is widely used, and yet it's recently come under attack a little bit as not being the best indicator of overall health. I wonder if you could enlighten us a little bit as to what exactly BMI is, its pros and its cons, and how you use it in your practice.
Sure. So BMI stands for body mass index, and it's really a measure of your essentially your relationship with gravity. So not only how tall you are, but how much you weigh. And a long time ago, there were tables that were developed looking at sort of the normal distribution of BMI. So folks that are kind of in the middle range, folks that are at the high range, folks that are at the low range. And for a long time, there was this idea that BMI was a really important determinant of health, overall health, whether that's cardiovascular, gastrointestinal, those sorts of things. What has recently come about is this discussion that perhaps BMI should not be the only indicator of health, that there are many other factors that determines one's health, whether that's your level of physical activity, what you're eating, how much you're sleeping. So although BMI certainly should not be the only determinant of health, I think that there are many who would argue that it should be at least a part of the overall picture.
Thank you, doctor. How can people then be proactive with this information, because as we say, there is weight discrimination even within the medical community. So what's some good advice or tips that we can share with the audience about being proactive about these issues?
I think first and foremost, if you are someone who is interested in improving your health, someone who wants to be proactive about this in your own life, one of the most important things you can do is focus on your health behaviors. And what do I mean by health behaviors? I mean making sure that everyone is getting a moderate amount of exercise, an activity that you enjoy, whether that's hiking, maybe it's walking your dog, maybe it is riding your bike. I also think that,
yeah, keep going.
I also think that one of the other really important things to focus on is making sure that you are engaging in other meaningful activities in your health, whether that's getting a good balance of macronutrients, getting protein, getting carbs, getting fat, also sleeping 8 hours a night. These are health behaviors that everyone can benefit from.
Doctor, sleeping. What is this you speak of? That's a whole nother topic for a whole nother day.
It's enough.
We'll be right back with more of our Tuesday mental health moment on JP, Kathy, and the crew on 1160 AM KBDT. Okay, we can. And Doctor, you're still on Facebook, even though we're on a break, technically on the air right now for a commercial break, but we're still on Facebook. So I'm going to let Patty and Steve keep the conversation with you going. This is fascinating. I just never thought if you go in and you're like, I think I've been exposed to the flu or strep or bronchitis or all the kinds of, strep, all the stuff that's out there nowadays. And then all of a sudden your doctor starts talking about your weight. I mean, golly.
So what
But this happens Kathy, this happens all the time though.
Wow.
I mean, the first thing they do is they weigh you. They
Correct.
take you in and they weigh you on a scale.
Right. Well, yeah, but that's normal.
No, it's not normal. Not when,
Not to be weighed?
I'm in for an ear infection.
Right.
Why are you going to weigh me so you can talk to me about my weight? I mean, and that's what people who are obese are thinking.
Oh,
They think, I don't want to get on the scale.
Okay.
I mean, look at me. I don't want to get on the scale. I'm here for an ear infection. Treat my ear infection.
What,
And so, because somebody that's obese, that's self-conscious, doesn't have the confidence, that's what they're thinking.
John, in fact, I'm so glad you are hopping in on this. Dr. Peat, Judge John Payton, who's the chair of the Morgan Foundation, is a man of size. And John, if you could go into with Dr. Peat a little bit, how you have been subjected to the weight stigma and weight discrimination throughout your whole life here.
Well, there's an assumption that if you are overweight and obese, then you're lazy.
Correct. Yep.
I think that's the big one. And of course, I'm not
if
lazy,
you're
never have
JP. He's JP, and Dr. JP literally is the so opposite of lazy. It's unbelievable.
Absolutely. I've watched his schedule on a day. Wow.
But then there's that stigma. You're right.
And so
one of the other
that's
things that's been interesting in some of the research is that there's also been some evaluation of healthcare providers who may perceive that individuals that live in larger bodies are actually less likely to be compliant. They're less likely to do what their doctors ask them to do. So this has really negative ramifications across the board.
Wait, to be compliant? JP, do you think you
hold on, Kathy. Well, so it depends on your doctor, right? Like
right.
You need to make sure that your doctor fits you. Just because you go to your insurance card and you got 10 people to choose from and you go in and you choose that doctor, if that doctor, you don't feel comfortable, if that doctor doesn't make you feel comfortable, then you're never going to be compliant and you are going to be defiant and you're going to walk
Agreed.
out. You may go back because they fixed whatever problem you had, but you're not going to listen to them. And so you have to have a doctor that's going to be sensitive to the fact that you are obese and overweight, and talk to you about it in a way where you can relate to the individual rather than standing there in your doctor's coat and acting as if you have no issues or no problems. And because it's bad. I mean, am I wrong, Dr. Peat, or is that right?
No, I think you hit the nail on the head. One of the most important things that happens in the visit is that relationship between patient and provider. And that's true not just in terms of medical visits, but also in terms of mental health. And, making sure that you have that good connection and you're working with somebody that you trust makes a huge difference in whether or not you'll actually comply with, taking the medications that they've written you a prescription for or following whatever, lifestyle recommendations they're making. That has a huge impact.
10 seconds.
Yeah.
All right, 10 seconds.
All right, we're going to come back. I'll
Good
bring
stuff.
us back in.
Okay.
Good morning. Welcome back to 1160 a.m. KBDT News Talk Sports. It is currently 8:54 in the Dallas-Fort Worth Metroplex. Again, your weather is going to be a high of 48 today, a low of 45, a freeze alert through Thursday, so be careful. And again, traffic is dicey out there. Be careful as you head into the Metroplex. Super excited. We've got Dr. Peat on the line, but we want to take a quick moment and wish Ron Baker happy birthday from JP, Kathy, and the crew.
Absolutely. Happy birthday to you, Ron, and thank you for being such a big part of the crew. So have a blessed year.
Happy birthday.
All right.
So
We're back with the Morgan Foundation and with the Something for Kelly Foundation and Dr. Peat and the Mental Health Moment. We're talking about all kinds of great things, obesity, what your doctor may, kind of relationship you may have. And so, Patty, go ahead. What's our next question?
thank you. One of the reasons I am so excited to have Dr. Peat on our show today is because she is uniquely qualified with her research background, her medical practice, her psychological and clinical background. She can talk to people about the medical issues around being obese, the psychological issues, and she's also fully versed in eating disorders. So the question to you, doctor, help us understand, when we're just talking about patients being compliant with medical advice that they're given from their doctors, how can they proactively, in addition to what JP was just sharing, have the doctor fit you, but how can they be proactive in that relationship with their doctor and accept that there are some things that are going to be medical conditions associated with obesity?
I think that one of the most important things that patients can do is to advocate for themselves, to be educated about whatever health conditions that you're struggling with or that you've been diagnosed with, and figure out what are the ways that you can manage some of those conditions in conjunction with your healthcare provider. So, I think that for a lot of people, what this means is, being online and looking for reputable information from organizations like the Centers for Disease Control or the National Institutes of Health, getting reputable information about your own condition so that you can be empowered to make the decisions that are right for you in conjunction with the medical advice that your physician may be giving you. So I think that, first and foremost, being able to advocate for yourself by educating yourself is a really important component in this picture.
It makes a lot of sense. On another note about disordered eating, talk a little bit about some of the struggles people have with food addictions, and as that might relate to either fast food or junk food or processed food, or help us understand that as a concept.
Sure. It's actually a really hotly debated topic within the eating disorders field and within the study on weight or obesity. This idea of food addiction is that individuals may find themselves addicted to foods, particularly, high sugar foods, high fat foods, in the same way that individuals struggle with other substance use disorders, whether it's alcohol, illicit substances. This is not something that has sort of been widely accepted throughout the field, although the science is growing. So I think the jury is still out on whether or not this is something that everyone in the community can agree on. But we do know that individuals that are eating higher amounts of highly processed foods, foods high in sugar and fat, do find them very rewarding in terms of those brain circuits.
Well, and doctor, because I hear about this loop, if I may interrupt real quick, it's like the salt, sweet, there's some kind of trigger that, like, once you eat something salty, then you need something sweet, and then it's cyclical and it never ends. Is there something to that? Because you hear about that a lot, and it's especially coming from everybody eating so many processed foods nowadays.
Sure. I think that part of what you might be touching on there is this idea that there are foods that we call highly palatable, things that we find very tasty just based on, sort of the human physiology, and things that our brains find increasingly rewarding. So it's sort of like when you're gambling and you're on a hot streak and you
Yes.
continue to get more and more money. It's the same kind of idea where you find those types of foods incredibly rewarding. So you're motivated at kind of this very basic level to continue to eat those foods in the same way that you're motivated to keep pressing that lever if you're at the casino, right?
Right. You're so right.
Interesting. Doctor, our time is up here.
Passed the ball at the right time, didn't I? Dr. Peat, I told you this time was going to go so quickly. I think we're going to need to have you back for another reason.
This is fascinating. Absolutely. This is such good information.
Thank you so much. This was every bit as good as I expected and hoped that it would be. And
Dr. Peat, thank you so much. Thank you for being a part of JP, Kathy, and the crew in the Mental Health Moment. You have made a difference. All right. We are JP, Kathy, and the crew. We want to thank the Morgan Foundation and the Something for Kelly Foundation. It is currently 8:59, and it is cold outside. So cover up. Be safe in your commute. And tomorrow, big day, Kathy, we have got something patriotic to talk about.
I love it. Can't wait. And Congressman Van Taylor tomorrow on JP, Kathy, and the crew. Have a blessed day.
We're 11:60 a.m. KBDP.
Is gone.
Okay, I think the doctor may have hung up. This is good advice. How can people get in touch with her or get more information about her?
Dr. Peat is the director for NC, the National Center of Excellence in Eating Disorders at UNC Chapel Hill.
Okay.
And she is, I was so excited to find out the credentials that she had, because sometimes we have subject matter experts that have mutually exclusive backgrounds. You either know about eating disorders or you know about bariatric surgery.
Right. But she's got both.
She can talk very intelligently to somebody who is struggling, compassionately with them. She understands what they're going through, the struggles that they're having.
Yeah.
And yet she can help them screen for eating disorders. So I don't know that she is uniquely qualified, but she's very specially qualified.
I've never heard of anybody with that background. JP, what do you want to add to this? JP, can you hear us? Thought he was still on. Shoot.
I do know if people wanted to contact her, it is Christine, CHRISTINE, Peat, PEAT. You do a Google search on her. I believe her email and office numbers are all online, and she's so incredibly responsive. So if you have any questions or want to talk to her about the topics today, she's there, and she will respond. We're just thrilled about that.
Well, and again, she's got such great information, and you just never think about that. Okay, right, like JP was in an urgent care, 24-hour urgent care on Monday for real bad ear infection. Then okay, why are you weighed? Is it just is that like I don't know. I mean, I'm asking. I don't know. Is it a legal thing that you're weighed? Because I know I'm weighed every time I go to the doctor. The kids are weighed for well visits, sick visits. You always get weighed and you get your blood pressure checked. It's like those are the two things you can count on.
I think it's more a way to cover yourself in case something does go south right after you leave. I mean, one of the first things a plaintiff's attorney is going to ask a doctor or med practice is, did you weigh them? Did you do their blood pressure?
Right.
Did you do some just standard tests to determine if there is a higher risk,
like a heart attack or stroke about to happen kind of thing? Right.
So that mindset is so ingrained now. I don't want to be sued, so I'm going to just get this done at the start.
And spoken like a true lawyer.
There you go. And there may be some ties between obesity and being overweight and types of ear infections, though, as well. So I don't know. I'm not a doctor, and I don't play one on TV. And I did not stay at a Holiday Inn Express last night. But I don't know. That it does need to change. We need to really educate our medical people out there about eating disorders and obesity and BMI and all that, and it's going to take a while. So
yeah, and we talked about the fact that in addition to educating them medically and psychologically, maybe just a little bit of enlightenment treatment where they begin to have a little bit of self-reflection and recognize, hey, why am I focusing on weight loss for an ear infection?
There you go.
Right. Yeah. That's, we're trying to get JP back on. I don't know which button we would need to push over there to get him.
And I left my stupid phone at home. It's kind of nice.
You're like,
it's
this has
free.
been-
Absolutely. Next week, we have a Harvard professor on to talk
Okay.
about various aspects of mental health. The week after that, we have an incredible woman who has made such a difference in the mental health industry here in this part of the state, Vanita Halliburton. She started a foundation going into teen suicide after her son
wow.
was taken. That's the Grant Halliburton Foundation.
Oh, yeah. Oh,
They
that's
do
right.
some incredible work. So she's in here on November the 12th. Hello,
So there's
JP.
JP. 'Cause do you have some more input on the weight thing?
Well, I've got all those questions. I mean, I've been on there the whole time, so.
Okay, I'm going to see. I hope Facebook can hear what you're saying. So talk loud. I've got my mic to you.
They probably can. Just make sure that I'm close to that little star thingy-majigger. So the reason why doctors weigh us, all of us, is for insurance purposes.
Oh.
And so they're putting on their chart. So if they don't weigh us, then they may not be able to collect their copay, because insurance companies want to know if they really want to renew your insurance next year or not, or increase your rates, because you become a high risk based on your weight.
Oh, okay.
That
Oh, yeah.
But you can be. I mean, here's the thing, JP. Like you. I mean, heck, I've battled high blood pressure since my 20s. It's a genetic thing. No matter size, weight, any kind of anything. My grandfather, my father, my brother, myself have all. We've all had to be on blood pressure medicine since our 20s. And see, and like you've never been on blood pressure medication, and you weigh more than me. And so there are people who can be, and you can be heavy and still be healthy.
Right. And
You
that's
know what I'm
correct.
saying?
Yes. In fact, if you remember back in the Renaissance days and before the Enlightenment years, and even in the early Enlightenment, most people were obese, and the people that were obese outlived the skinny people, because obese people could handle what illnesses may be coming and what may hit them, because they had some fat to fall back on, and they were healthy. They were just overweight. And skinny people, if they got sick, they could get dehydrated much easier. All kinds of bad things could happen. It became a deal where it was more about what you looked like versus your health. And so in the doctor's office, though, the whole weighing thing, I go in for an ear infection. Why do I need to be weighed? I don't need to be weighed. Don't
Right.
weigh me. Put on your chart, refuse to be weighed. I don't care what you do.
Oh, you know what? What happens if you refuse to be weighed or refuse to have your blood pressure taken? Would a doctor still see you?
But possibly not, depending on the doctor, right? Now, the blood pressure, they're trying to determine where you're at right then, right?
Right.
So now here's what your doctor will tell you. If you have a good doctor, and I've got a good doctor, what they'll tell you is that your blood pressure fluctuates all day.
Oh, I know that.
And it fluctuates dramatically. So, like anticipating going to the doctor's office, your blood pressure goes up.
I've got they call it, like that white coat syndrome
Right.
or whatever,
Right.
and it's legit. I will tell them. Obviously, like with my regular doctor, it's any of my doctors who I deal with on a regular basis, it's all over my charts. And they'll be like, okay, did you take your medicine at night instead of in the morning? It depends on if it's early morning appointment versus a late afternoon appointment. But then if I go to somebody, like if I'm in an urgent care situation or something, there have been times where I literally tell them, these are the medications I'm on. I have, a genetic hypertension that I've had since my 20s. And they're always looking at me like, you can't have that. And then they take mine. I said, you can take my blood pressure now, or you can take it in about 5 minutes when I'm not stressing out about taking my blood pressure. And it's going to change. I'm going to look like I'm at stroke level when you take it. And there are times